The benefits for patients are amazing, really.
If the system works properly, the patient would never have to call an ambulance and they would never have to present to the emergency department.
They also recover quicker because they're not waiting for their treatment.
They love the fact that they don't have to be anxious about their condition at home. They love the fact that there's a friendly voice at the end of the line. The Rapid Access Service is a new service that we have designed for a particular cohort of patients. Now, these patients are known to the specialist respiratory team.
The Rapid Access Service is a 7-day-a-week triage service that's nurse-led. We already know all about them, we know why they're here, so it's better for them to come straight to the specialist service rather than going through the emergency department where they'll be waiting to give the same information that they've given many times before. It's speeding up the process and it's allowing better flow of patients within our hospital service.
At present, our system is designed so that if someone is in the community and they experience a worsening of their medical condition, they have very few options. They can go to their GP, which can often take days, or they can call an ambulance, which involves them having to wait for an ambulance, come to an emergency department, wait for assessment, and then wait for admission. So the Rapid Access Service is designed to give them an alternative.
The rapid pathway is streamlining the patient's journey. It's making sure that the patient is cared for by the speciality group rather than being seen in the emergency department by many different staff members.
The Rapid Access Service is designed to give them a direct line of communication with their specialty team from the community. If a patient, for example, gets an exacerbation of their condition, they pick up the phone and they call the specialty team, and at the other end of that line will be a senior nurse or a nurse practitioner who will be able to give them advice on their condition. If they come back into hospital with their same condition, their length of stay as an inpatient is less than it would be if they had gone through the usual pathway through QAS and ED and admission.
I'm excited to see other specialities use a similar model. I think for people with chronic disease, this is certainly the best way forward. Patients are so grateful not to have to go through the emergency department, and it means that they get their care quicker and they're finishing up in a better frame of mind and a better state of health.
This is incredibly exciting for us because we would love to see this just become the new norm for admitting chronic patients. It's so much better for the system, but as well as the patients. It's more efficient. The teams have been so engaged, and the respiratory team in particular has been brilliant in the way they're managing these patients.